Hello, I'm Dr. Beech. Today we're going to talk about the most common knee complaint that I've seen in my office in 32 years of practice. Um, it has a long name. It's called osteochondromalacia patelli. I call it, for the sake of simplicity, dragging kneecap disease. Um, the name osteochondromalacia does explain what happens, though, because osteo means bone, chondro means cartilage, malacia means softening of the cartilage, and patelli means patella or kneecap. So what happens in osteochondromalacia patelli, or dragging kneecap disease, is that the undersurface of the patella, which has to slide over the head of the femur, not the head of the femur, but the end of the femur, as it's sliding through this groove, it starts to wear out on the underside. The cartilage there begins to wear down. And as it does that, it drags the area and starts to become inflamed, accumulates toxins, inflammation, scar tissue, fibrocartilaginous gunk and glue, and that area becomes hurting as we go up and down the steps. Let's take a quick look at what the anatomy is. So this shows you the structure of the knee. You can see the femur, the tibia, the meniscus between those two bones, and then how the kneecap is actually embedded in the quadriceps tendon. And as the knee bends, we'll pretend my elbow is a knee. As the knee bends like this, the kneecap has to slide over that bone, over the femur bone. And that sliding day in, day out for many, many, many years, because our knees would probably take more stress than most other joints in our body, knees and the feet, I would say. Over time, that cartilage does wear down, and we start to develop those inflammatory toxins will stick there. One thing to always remember is that the joints are by nature an area of incredible stress because they're attachment points for many different tendons and ligaments. That creates a lot of stress on the area. If you pull your hands this way, you'll feel the stress in your hand because that's where the attachment point is. It's the same way with the bones and the way that the tendons attach to that area. And then in addition to that, we're using that area a lot. And so in the knee joint, we have a lot of tension there. And so circulation is reduced. And as circulation is reduced in those points of attachment, they already become a wonderful place for stuff to get stuck in. These toxins have an affinity for sticking in areas of poor circulation. So over time, over the years, these tight areas like the kneecap and the tendinous insertion of the quadriceps tendon into the tibia can accumulate toxins and inflame the area. And then we get this osteochondromalacia patelli. So what do we do for it in our office? Well, we can treat it in a palliative way by putting electrical stim on the area. That does reduce inflammation. We have to always look at the etiological factors. Women do get this more than men because of the hips are a little broader in women, and so the knee has a tendency not to be straight but a little bit more like this. And that does cause the kneecap to not move through the groove properly or as easily because of that. But also foot pronation, again, as we talked about in IT band and many other syndromes, as foot pronation occurs, it causes the knees to become knock-kneed rather than like this. And then that also aggravates this dragging kneecap disease. So we have to look at those factors to see if they're a problem and correct them. I do use my Ayurvedic creams on this area as well. Whatever cream I prescribe, usually pain cream, Flex and Flow, Maha Vedana Shanti, Super Sport, one of those kinds of creams. What we do is bend the knee and pull the kneecap down. Okay, so if this were the femur and this is the tibia, we bend the knee, pull the kneecap down, and then right across the top of the kneecap, if we take our hand and just go across the kneecap, assuming my hand's a kneecap here, then as we go across, will feel these really, really tight fibers, and they'll be very painful. So what we want to do is put the cream on and then work those fibers across. The fibers are going this way, up and down the leg. So we want to go across them like this, work them with our fingers or our thumb, and then apply the cream, swiping the cream down toward the feet like this. And do that twice a day, just like I suggest one does for the IT band and the arm. We do that twice a day, once with the massage and the cream, and then another time with just the cream, so morning and evening. And I suggest doing these when I tell you to break down that area with your, by doing cross fiber massage, breaking down those adhesions. I suggest you do that in the morning, because that's releasing some toxins into the blood, and then we want to have the day's metabolism to metabolize through that. So we don't want to do it at night, because then we'll be breaking down that, what's called amavisha in Ayurveda. We're breaking down those packets of amavisha, and they're going to, because circulation is not very good when we're sleeping, then they can get stuck somewhere else. So we want to do that during the daytime, so we have the day to metabolize it out. So this is how we treat dragging kneecap disease. I hope this helps you understand a little bit more about what's going on with that. And if you have that problem, then give us a call. Thank you.